Hey everyone, Michael Dudley with Engooden Health. I have an awesome patient success story to share with you today between our care navigator Valerie and her patient Jane Doe that shows that some hospitalizations can be prevented from needs that are not clinical whatsoever. Now, as a background on Engooden Health, we are hired by a primary care practice to reach out to their patients every single month and through education, coaching, and accountability, help these patients make lifestyle changes, ones that keep them out of the hospital. It's completely paid for by Medicare and other programs. Now, in the story, Valerie goes to call Jane, who lives in the South, for her July monthly call. So, of course, she wasn't surprised when Jane responded to, "How are you?" with, "I'm hot." However, what Valerie was surprised to hear was that 88-year-old Jane's air conditioning unit was broken in 80-degree heat. Valerie asked Jane if she had someone coming out to look at it, which Jane responded she was trying to find a used or cheaper option for the past 4 days since she was having some financial difficulties. Now, knowing that identifying and intervening with social determinants of health needs is a top priority here at Engooden Health, Valerie worked with our partnering practice who purchased and installed a brand new air conditioning unit for Jane as quickly as possible. Jane was so thankful that Valerie called when otherwise she would have continued to look for an affordable option in that 80-degree heat for another 4 days. Now, this is a perfect example about how scaling a chronic care management program to rising risk patients can bend the cost curve and preventing these acute hospital visits. This partnering practice knew that paying $250 to $300 for a brand new AC unit could prevent this hospital cost of tens of thousands of dollars, really bending that cost curve and, more importantly, doing the right thing for patients just like Jane. We even heard from other clients who've leveraged these care navigators to ask all their COPD patients each month this summer about how consistent their air conditioning unit is and qualifying the need for a brand new unit. We can really be that force multiplier to advocate for your patients and lower the cost of care. If you'd like us to be able to repeat this amazing success with your patients, with your practice, we'd love to hear from you. You know how to reach me. Have a great rest of your day.